Good day. Welcome back to the Vitality Project. I'm Dr. Bob. Yesterday, we asked ourselves to take a good hard look at possible symptoms that may have cropped up for us during the current virus pandemic and lockdown. And we included in our list of possible markers, we're talking about psychological distress here. We included such markers as increased anxiety, depression, attentional difficulties, and addiction. In fact, since I initially wrote yesterday's blog, I've been doing some internal math on the statistics I shared with you then. As I mentioned then, if we have leapt up from 10% prevalence to 33% of the population, that is, who are currently suffering with anxiety or depression, well, it begs the question, at least for me, well, what about the statistics in regards to the prevalence of addiction? Let's talk about this for a second. Prior to COVID, fully 25% of American adults, and I have to qualify this, I find it a bit ironic and tragic, that adults are considered in these studies as being anybody over the age of 12. Fully 25% of Americans over the age of 12, or so-called adults, before COVID, were already addicted to substance, including alcohol, nicotine, and the other mood-altering drugs. That's 1 out of 4, again, prior to the virus pandemic and lockdown. I don't have exact statistics yet, but imagine this. If anxiety and depression have more than tripled during these past 3 months, what if anything close to that is also true for substance addiction? It takes your breath away. You can join me in the math here, and it's only a hypothesis, of course, but that would mean that upwards of 75% of American adults might well have increased their addictive behaviors around substances, including alcohol, including nicotine, and including the other mind-altering drugs. That's enough to blow you away, isn't it? Let's add even more. If before the pandemic, already 90% of Americans acknowledged having at least one behavioral addiction, that would be all the addictions except for addiction to substance. That would include compulsive eating, compulsive sex, compulsive gambling, compulsive spending, much less compulsive internet use. That's just for starters. If 90% of Americans say they currently have at least one behavioral addiction from that list, well, you obviously cannot triple 90%. That's more than 100%. You can't have more than 100% addicted. But the signs aren't good there either, are they? I'd like us to take a moment today to survey even a deeper dive than we did yesterday, and maybe deeper than you've done before, to survey your own potentially addictive behaviors, specifically over these past 3 months during quarantine. Have you seen increases in your own possible self-medication? That's what the literature oftentimes, how it describes addictive behaviors as a form for us to self-soothe or to self-medicate, oftentimes to help manage our anxiety, help manage our depression, help manage our cognitive difficulties. Have you seen an increase there? Come back tomorrow and we'll talk more about this in the context of another simultaneous nationwide pandemic, as well as moving in our next conversations towards proposing possible antidotes to all of this. Thanks for joining me today here at the Vitality Project. Stay healthy, please be well, and I look forward to seeing you here again soon.